Welcome to Variations 4, Neurological Unit. In this video, we'll be covering questions 21 to 23 on spinal cord injury, SCI. Quick overview of its effects on the GU, GI, and temperature. All right, so for 21, how might spinal cord injury influence the GU system? We just look at map 12 here to get a quick summary. So you got a spinal cord injury. Basically, you can have overfilling of the bladder. This can cause reflux into the kidney and cause kidney failure. Basically, the brain's not picking up on the fact that the bladder is full. And the person's not able to sense it. One of the interventions is frequent self-catheterization. You'll see many people in the community self-catheterizing every few hours. And in the community, they use a non-sterile technique. And they do reuse equipment too, because it gets very expensive if they try to do it the same way as we do it in the hospital, which is sterile technique. The other issue that can come up, of course, is you can just simply have uncontrollable emptying and incontinence. And I guess these two can go hand in hand at some point, and because the solution is the same. Self-catheterize quite often, you don't have to worry about that it will empty on its own. The next question asks us about effects on the GI system. So if you have an injury above T5, then it's the parasympathetic system that's inhibited. Okay, so above T5, you could be affecting the brain's communication with the parasympathetic system. And therefore, that's rest and digest. So everything to do with that, including peristalsis and motility, might be decreased. You get that constipation. Okay, and then everything that goes with that could end up being paralytic ileus, which we talked about in the unit on the GI system. And then depends how bad the ileus is, depending on what you might need. Maybe it's just bowel rest, maybe it's surgery. Maybe the loss of motility is causing gas to build up in the stomach. It's very uncomfortable and causing nausea. In that case, you need an NG tube. Maybe medications such as metoclopramide to encourage motility and emptying of the GI tract. These are all possibilities. There's no set answer. It depends on the nature of the injury. It depends on how the patient presents. But these are all possibilities. Of course, when you have a loss of motility, you might have a buildup of hydrochloric acid in the stomach, and you're at the risk for stress ulcers. So in that case, you'd want to get anti-ulcer medications. These are all possibilities. Finally, question number 23 on temperature regulation. Well, the bottom line is that with a spinal cord injury, the patient's unable to pick up on peripheral temperature sensations. They can't feel if they're hot or cold. You think about what the core temperature of someone should be, somewhere between 36.4 and 37.4, and then you think of a temperature of a room, which is at 23, degrees, say on average. This person could be feeling cold and not be able to tell you that. So the idea is to try and pick up on, I guess the nurse or caregiver would have to pick up on how they're feeling. Like if I'm wearing a t-shirt and I'm cold, then I have to assume that the person who's got this spinal cord injury, who's unable to feel temperature, may be feeling cold too, and apply blankets, or if they're too hot, a fan, etc., etc. Okay, so taking an oral axilla or axilla temperature frequently is a good idea to actually see what their temperature is.